viewers, welcome to a new vlog. I'm Dr. Joydev and welcome to my YouTube channel. Today's topic is lymphoma. Now, before going on to discussion, let me tell you what is lymphoreticular system, because lymphoma is a type of cancer that is associated with the lymphoreticular system. Lymphoreticular system is the basic factor behind our normal immunity. So it builds our normal immunity, and the components are lymphatic vessels and lymph nodes. Now here in this diagram you can see the green colored thread like structures. These are lymphatic vessels, and the green colored dots are the lymph nodes. Now these blue colored thread like structures or lymphatic vessels, what are their functions? Their function is to carry lymph, and lymph is comprised of a liquid portion and another part is lymphocyte. So the type of cell that resides within the lymphatic vessel is lymphocyte. It is of two types. One is B lymphocyte, another is T lymphocyte. Now B lymphocyte helps to build immunity by producing antibodies. As we know that antibodies are those chemicals which helps to fight against the various organisms like bacteria, viruses, parasites, etc. And T cells, they are also helpful in building immunity by building a cell mediated immunity. So for a normal immune system, in one hand there is antibody, in the other hand there is cell mediated immunity. These two are the vital components of immune system, and this anatomical structures or this anatomical system that is known as lymphoreticular system, and the key components are lymphatic vessels and lymph nodes. So if there is some primary malignancy involving these lymph nodes, this is known as lymphoma. So the primary malignancy of lymph node, that is known as lymphoma. Now, what are the types of lymphoma? Lymphomas can be classified grossly into two types. The first one, that is Hodgkin's lymphoma, and another one that is non-Hodgkin's lymphoma. Now let's understand what is Hodgkin's lymphoma. Hodgkin's lymphoma is a type of lymphoma where you will find a special cell that is known as RS cell or Reed-Sternberg cell. These cells are seen under microscope. Okay, so if any involved lymph node is examined under microscope, and if the pathologist, he or she, finds any RS cell or Reed-Sternberg cell, then that type of lymphoma is Hodgkin's lymphoma. And if there is absence of this RS cell, then the type of lymphoma is non-Hodgkin's lymphoma. This non-Hodgkin lymphoma can again be subclassified into a lot of other types, and those types are there is variation in the clinical features, treatment response and severity among those subtypes, okay, of non-Hodgkin's lymphoma. There are few non-Hodgkin's lymphoma which are high grade, and there are some non-Hodgkin's lymphoma which are of low grade. So there is a spectrum of clinical features related to the lymphoma. So lymphoma is basically classified into Hodgkin's lymphoma and non-Hodgkin's lymphoma. Non-Hodgkin's lymphoma can again be classified into a lot of other types. Now let's talk about the symptoms of lymphoma. Generally, there are few symptoms which are related with lymphoma, but it is not like that if you are having one or more of these features, then you are having lymphoma. That is not like that, because these symptoms are common to many other diseases also. If you have multiple symptoms and these symptoms are persisting for a longer time, then you must be consulting with your physician. He will guide you and he will investigate whether you are having lymphoma or anything else, because swelling of lymph node is not lymphoma. Swelling of lymph node or lymphadenopathy that can be caused by a lot of other diseases. So we have to first investigate whether the swelling is due to lymphoma or anything else. Okay, now the first and the most important symptom, that is lymphadenopathy. Lymphadenopathy means there is abnormal size and shape of lymph node. So what happens in case of lymphoma? There is abnormal proliferation of the lymphocytes. These lymphocytes, then the number of these lymphocytes gradually increases within the lymph nodes, and that makes those lymph nodes to enlarge. Okay, so what happens? There is increased number of lymphocytes within the lymph nodes due to mutation in these lymphocytes that causes rapid proliferation of these lymphocytes, along with there is decrease in the destruction of lymphocytes. So in one hand there is increased proliferation, in the other hand there is decreased destruction. So what happens? So the number of lymphocytes that gradually increases, and those abnormal lymphocytes, they causes enlargement of the lymph nodes, and these lymph nodes are usually palpable in various regions. Peripherally they can be palpable in the cervical or neck region, axilla, in and when these enlarged lymph nodes are present within abdomen or thorax, then they can be identified by various imaging methods. Now talking about the causes, the a lot of times the exact cause behind lymphoma is not known. It is assumed that there is some kind of mutation within the lymph node, within the lymphocytes, that causes their rapid proliferation and decreased destruction. So but there are some risk factors. There are some risk factors which have been shown to be associated with development of lymphoma. The first one is age. Some types of lymphoma are commonly seen in some age groups. Suppose Hodgkin's lymphoma, it can be seen in early age group as well as in elderly patients. So it has a bimodal distribution. Other lymphomas has a specific median age of presentation. Some presents at the age group of 30 to 40. Some are common at the age group of 50 to 60, like that. Now the second risk factor is gender. A lot of studies has seen that the lymphomas are somehow slightly more common in male population than female, but it is not like that that it occurs in only male. It is not like that. It is seen that it is slightly have a higher incidence in males. Now the weak immune system is a risk factor for development of lymphoma. There are some diseases which causes, there is decreased efficiency of the immune system, or some diseases that causes there is decreased efficiency of the immune systems. Also there are some medications which causes suppression of the immune systems. There are some chemotherapeutic drugs which can also cause weakness of immune system. So if there is presence of weak immune system, that can be a predisposing factor for development of lymphoma. Now the next one, that is infection. Infection means there are a few organisms which have been shown to be associated with lymphoma. What are those organisms? The first one, that is Epstein-Barr virus or EBV. Next is another bacteria that is known as H. pylori. So this EBV is sometimes causing a fever with enlarged lymph node like presentation. This H. pylori, as we know that it is associated with stomach ulcers or duodenal ulcer. So these are the two organisms which is seen to be closely associated with development of lymphoma. Next, I'll talk about the tests or the diagnostic methods. The most important is lymph node biopsy. The first one is the physical examination. That means your physician will examine you. He will determine what are the number of lymph nodes that are involved, what are their association with the surrounding structures, what are the different groups of lymph node, what are their consistency, their feel. So he will have an idea about the involvement or the spread of the disease. Next, the most important investigation in diagnosis of lymphoma, that is lymph node biopsy. Lymph node biopsy is a very important investigation in diagnosis of lymphoma. What we do in case of lymph node biopsy, usually lymph node biopsies can be done by a lot of other methods. In case of lymphoma diagnosis, what we do usually, we do perform a excision biopsy. What does it mean? Excision means if someone having multiple enlarged lymph node, then one or more lymph nodes are selected, and those lymph nodes are taken out by surgical dissection, and those lymph nodes are subjected to a lot of histopathological examinations and some additional investigations in some cases. And by looking at those lymph nodes under microscope, a pathologist usually diagnose whether there is presence of any lymphoma or not, first of all. Next, if the lymphoma is present, he will classify it according to the morphological features of the lymph node. Also, he will have an idea about the grading of the lymphoma, that means whether it is high grade lymphoma or low grade lymphoma, like that. Another investigation is FNAC, that means fine needle aspiration cytology. What happens in case of lymph node biopsy? We usually take out the lymph node as a whole, but in case of FNAC, what we do, FNAC means fine needle aspiration cytology. So here we put a small needle in the lymph node and take out very small amount of tissue, and we examine those tissue under microscope to detect whether lymphoma is present or not, and if it is present, what type of lymphoma. We usually get an idea about those things. Next investigation is ultrasound. Ultrasound is very cheap and easily available investigation options. It usually give you a basic idea about the nature of the swelling, whether it is lymphoma or it is due to any other infection or inflammation, or it is due to tuberculosis or not. So ultrasound also gives us important some ideas about the nature of the swelling. Next investigations are CT scan, MRI, PET-CT. PET-CT is such an investigation which help to detect occult malignancies. That means if there is a high suspicion of cancer but the site of cancer is not determined, then we do perform PET-CT. PET-CT usually detect occult cancers, and also it can help to detect whether in internal lymph nodes are enlarged or not, or whether it is due to reactive causes or it is due to some malignant causes. Next, so there are some blood tests which usually guide you in making a diagnosis, or sometimes these tests help us to during prognostication of a disease, during response to treatment assessment. So there are some blood tests also. Now coming to the treatment, but before going on to details, let me tell you, if you are new to my channel, then don't forget to hit the subscribe button, because in this channel I usually describe all the health related issues in a very simplified way, and you can ask me any questions regarding this topic in the vlog, and you can post your comment in the comment section below. I'll try to answer your comment. And if you think that this video is helpful, then don't forget to hit the like button also. Now coming to the treatment, the first option is surveillance or observation. There are some lymphomas which are of low grade, usually in their early stage. We can observe them whether there is any adverse event or the quality of life is maintained or not. Initially, suppose the tumor is of low grade, then there will be no additional problems. But if they gradually upgraded to a higher grade, then we can initiate treatment. What are the treatment options? Chemotherapy usually. In case of lymphoma treatment, we usually give a regime of treatment. That means there are multiple drugs. Usually these drugs are given by intravenous route, that means by injection. There are some oral chemotherapeutic agents also which are found to be helpful in in a few conditions. Next is radiation therapy. Radiation is a very important type of therapy. Usually it helps to reduce the size of the lymph node. Next is bone marrow transplant. There are few types of lymphoma where we can transplant the marrow. What happens here? Here the bone marrow stem cells are first destroyed with the help of chemotherapy or radiation. Then there is the transfusion of fresh stem cells, and those stem cells after transfusion they will reconstitute the immune system and they will build a normal immune system. So sometimes bone marrow transplantation can help in treatment of lymphoma. Next is CAR T therapy. CAR T therapy is a very advanced modality of treatment. It is a very advanced option. It is not available in every country, and what we do here, we take out the lymphocytes from the patient's body, then genetically engineer those lymphocytes, that those lymphocytes can detect cancer cells. So after transfusion, those lymphocytes, those genetically modified lymphocytes, now they can easily recognize the lymphoma or the cancer cells and they can kill the cancer cells. So these are the options of treatment we have. So I'll have to close this vlog right here. If you are new to our channel, then don't forget to subscribe and don't forget to hit the all notification button. If you find this video helpful, then don't forget to give us a like. And till then, take care and stay fit, be healthy. Thank you.